I'm with Maxine, brings him back Janice, who is the author of an article that was published in October 2011 in Health Affairs, the Journal of Health Affairs. Maxine, thank you for joining us today. The article was titled "A Dental Hygienist Who is a Lakota Sioux Calls for New Mid-Level Dental Providers." Maxine, I was wondering if you could tell us a little bit about your background as a dental hygienist before we talk about the article.
I'm a dental hygienist on faculty in at Northern Arizona University in the Department of Dental Hygiene. So I teach at the university, and then my focus area of research is in oral health disparities, and that's primarily in tribal communities, American Indian communities.
How did you become a dental hygienist?
How did I become a dental hygienist? I was previously a dental assistant before I decided to pursue an education in dental hygiene. So I was a dental assistant with the Indian Health Service for 20 plus years. And then while I was working for the Indian Health Service, I pursued higher education to become a dental hygienist while working for the Indian Health Service.
Well, the article that was published in Health Affairs was chronicling your experience at the Pine Ridge Indian Reservation in southern South Dakota. This is a reservation that, according to the article, is about 3 times the size of Connecticut, with about 40,000 residents. And you went there to conduct a study of about 300 residents, according to the article. Can you tell me a little bit about what you found with this study? What were some of the findings that you had?
Well, some of the findings were that we have a population in this country, an American Indian population, and it's not just this population, but other populations, American Indian populations, who are experiencing oral health disparities. But on the Pine Ridge Reservation, we looked primarily at that population just to determine what their unmet health needs were, and it was quite startling to see that there was a tremendous amount of unmet need among this population. And, it all, there are several reasons why. For the population, we have 3 Indian Health Service clinics that are on the reservation, but that doesn't, you think that just because you have a healthcare delivery system, then individuals can access care. But that's not always the case. It doesn't imply that, there's access to care. And many of those reasons are could be based on socioeconomic status, which includes not having fuel or gas to get to the clinics. The clinics sometimes create barriers for accessing care. So there's numerous reasons why, among this population, it's difficult. It's a challenge.
Well, as the title of the article implies, and you did write quite a bit about it, you are advocating a mid-level provider to increase the level of care in a population such as one that you were working with at Pine Ridge. Why is this so important to you, the mid-level provider?
The mid-level provider, I think, is the answer to the issues that I describe in the essay. We have on our reservations, there is not very many dentists, and let alone native dentists, to provide services. And I think that we really need to create a model very similar to what we have in Alaska that goes out into the community instead of the community coming to the clinics. So, creating dental homes external of the dental clinic is critical if we're going to address the health disparities that we are facing in many of these tribal communities. And which is the reason why I'm advocating for the mid-level provider.
Why is it so hard for dentists to be providing this care? Secondly, and secondly, what are some of the unmet needs that are being unmet by the shortage of dentists?
Well, today we, particularly on my reservation, like I said, we have the dental clinics, we have the facilities there, but then we still are experiencing, when we did the study, we had 85% of the children had active decay. We had approximately 90 some percent of adults that had active decay. And to me, that's telling, and it's telling, but it's also telling me that, what we have today on our reservation is not working. So, and then the question you ask is, why don't we have enough dentists? There are no dentists, there are very few, I'll say, very few dentists who will go out in these rural and remote areas and practice dentistry. If they do, it's often on they're there for 2 years. We don't have the continuity of care that is so necessary to be that pivotal point that changes the disparities that we're facing. So when I say mid-level providers, we grow these mid-level providers within these communities who stay in these communities. Or return to these communities and provide the service, then we have the continuity of care. We have that potential to impact, the issues that we're facing on my reservation and many reservations throughout Indian country.
You did mention this in your article, the fact that Minnesota does have a mid-level provider program that is just graduated, just first class. Do you see hygienists graduating from the program and moving to the reservation to provide the care?
Well, ideally, that would be great, which is why, we are, I constantly am working on recruiting American Indians into health professions, and then one of the focus areas is dental hygiene. So, if we could train and provide education to minority populations and level that playing field, and these individuals return to tribal communities, I think that we can start to make significant inroads in this whole issue.